I compare the nose to a chain. If you loosen or tighten one part of the chain, it's going to affect the whole chain. And a lot of times patients come to me and say, well, I don't like this hump, Well, it's not just the hump. There are a lot of factors that need to be addressed and done at surgery so the nose looks balanced and functional. It's very important to know after rhinoplasty is done, if the inside is not addressed properly, that the patient will have or could have problems, for example, breathing or other structural problems that need to be addressed. My goal as a plastic surgeon is to achieve the most natural result possible with a rhinoplasty. In terms of approaches, there are two types of approaches for rhinoplasty: the closed technique, where all the incisions are inside the nose, and the open technique, which basically is an additional scar underneath the columella, which is here. And this allows me to peel the skin back and look at the nose three-dimensionally. Most of the rhinoplasties that I see require a lot of things done to the nose to make it look natural, and so in 95% of my cases I do use the open approach. The rhinoplastic consultation takes approximately 30 to 60 minutes depending on what we need to address. The surgery can take anywhere from 2 to 4 hours, and it is done under general anesthesia. If the patient had a complete rhinoplasty, and especially if we had to narrow the bone, the patient will have a splint on their nose, mainly for protection, and also packing in the nose. The splint and the packing is usually taken out at about 7 days. Patients should still refrain from doing a lot of activity the first month, because any kind of activity, especially if it involves heavy lifting or bending the head down, is going to cause swelling. And swelling is our enemy. We want to minimize the swelling. And I always emphasize to the patients the nose will take at least 6 months to a year to get its final shape. So they have to be patient. It will get better with time.